Everybody, Dr. McKinley talking about some healthy golf tips. I'm not going to teach you how to become a better golfer, but I am going to teach you how your body can be better prepared to play golf. We'll go over 3 movements that are really important for power and flexibility, so you don't have to swing harder. You can swing lighter, more efficient, and healthier for the spine. But before we go over those 3 tips, I also want to just quickly talk about herniated discs for a moment. So a lot of golfers either think they have a herniated disc, or maybe they've had an MRI that says they have a herniated disc at L4 or L5, which is the bottom part of the spine here. It's where those discs become swollen and maybe start to push out on a nerve. Most of the time, those cases do not, I repeat, do not need surgery. There's a lot you can do naturally, especially for chiropractic care. We see those patients all the time. So if you know anyone who has been diagnosed with a herniated disc, send them over to us. There's a good chance we can help them naturally correct the problem rather than go a more surgical route, which is scary and many times not effective long term. So the 3 movements I wanted to show you that are great for golfers. Number 1, when we swing, we want to get nice flexibility from the pelvis. So a great exercise. So you see guys at the golf course doing this kind of thing, which I don't really know what the heck they're doing. So that's pretty much pointless. What you should do is this: stand up against a wall about arm's distance apart. Have your golf stance, and then just practice rotating to the side, touching the wall. See how my feet didn't move? Because when you golf, your feet can't move. You shouldn't be lifting up your foot. So practice getting that twist without lifting up your foot. Practice the other side. Do about 10 to 20 of those rotations. I would do those every day. Those are a good thing to do as you're taking a break at work, as you get out of your chair. And that'll help with flexibility. The second movement I want to talk about is a power squat, or a wall sit. So you can sit up against a wall, 90-degree angle. If that's too difficult, you can brace and or put your arms out and just hold there for about a minute. If you really want to go good, try to go 2 minutes. After a while, you're going to feel your legs start to burn, your abdomen's going to start to burn. And the reason why that's important: when you're in those stances to golf, if you have a weak stance, you're going to try to overswing and use your back too much. When your stance is strong, it's just effortless. You can just barely swing, and that, assuming it's not uphill, it should easily go 200 yards without even trying, maybe 250 if you got a good swing. It's not about overswinging. All you good golfers know that. And then the last movement I would like to talk about is for your arms. So most of you, if your handicap's like 10 or more, you're probably not trying to, break, when the club comes up, you're probably not trying to break your wrists. You're probably trying to keep that arm straight, so you're more likely to have a straight shot. So to work on arm flexibility, very simple. Stand up against a wall, your toes, your butt, your shoulders, and your head should hit. Pull your arm across your body without twisting your body. Just pull it all the way across. You'll feel it pulling your shoulder, maybe your tricep a bit, maybe even back by your scapula, which is like the chicken wing in the back, and then do the other side. So see how I'm not twisting over, I'm letting my shoulders stay back. And that way my body's used to that twist without having to use too much wrist. You get just like that. So those 3 motions, we talked about the wall squat, we talked about the arm, and we talked about the rotation, keeping the feet flat. Work on those 3 motions. Hold this one for about 20 seconds. Do 20 twists back and forth in the wall squat. Try about a minute. If you can go a minute, 2 minutes, do more. And remember what we said about herniated discs. Let's avoid them in the first place by having healthy movement. If you know someone who's got these problems, let's get them back on the golf course safely, and so they're having fun and enjoying life. Dr. Heath McKinley, have a good golf season. Bye-bye.